So good evening, ladies and gentlemen. It is a privilege for me to be with you tonight, where we're going to educate you, inform you about Alzheimer's and dementia. On behalf of the Haitian Catholic community and the Health Committee, I welcome you. And more specifically, I want to welcome the Alzheimer's Association, where we have two knowledgeable individuals who are going to talk to us, inform us about this topic, which is Alzheimer's, as well as dementia. We want to thank the following two people: Ms. Joanna Hernandez, for accepting to be here with tonight, a Saturday night with us, as well as Mr. Michael Williams. Those are the two people who are here tonight with us who are going to talk about dementia and Alzheimer. We want to thank you. Thank you so much. I know it's not that easy to fit us in your schedule, and you did. And from the bottom of our heart, we thank you. And as you all know, there is nothing we can do without God. Whatever you believe in, you got to call upon whenever you feel like, there is a need. And then tonight, before we start, it is an obligation for us to really call upon the Holy Spirit to assist us. With this being said, we're going to bow our head in a moment of silence. We're going to call upon the Holy Spirit. Heavenly Father, though that we are not physically together, I pray for unity and love among us on this panel and the world, while humbly asking you to fill us with divine wisdom and grace. Guide us, O Lord, and let us grow in understanding and peace with one another. I pray this, believing in your holy name. Amen. And once again, thank you. As I mentioned to you, we have two wonderful people who are going to talk to us tonight about, Alzheimer. Before I start, some housekeeping. I want everybody to put on mute. When it's time for you to talk, you can talk. And everything going to go at one shot. Then at the end, we'll take questions. Et je regrette si je ne dire bonsoir à tout le monde distinctement. Amis de partout, fidèles à programme ça que ekip Sante mette sous pied. Et nous toujours là, et nous connaissons plus qu'à venir. Nous vous remercions, et c'est un privilège pour nous avoir à soir. Avant de commencer avec la présentation, comme je l'ai dit, nous avons mis nos soumis, laissez temps pour question après question. Et puis, nous allons gagner pour nous prendre zip code parce que c'est pour nous aider l'organisation qui est une grosse organisation que nous menons à soir pour. So without further ado, I am going to take the time to present you the speakers for tonight, the background a little bit, and also the members who are going to translate for you, to interpret for you so that you understand what's going on. So your question can be more informative for you to understand. So the first, before I go ahead, for the first presenter, it's gonna be Miss Joanna, and Rose Colin Joseph will be the one that translates for you. And she's part of the team, which is the health team. If I can see Sir Colin.
I'm here.
Okay. And we're also going to have Barbara Fonrose. She will be the second interpreter. And as part of the members, part of the team, we have, I don't want to forget anybody, we have Dolly Renee Arnold. Hopefully she's on at this moment. Just say hi if you're there. We also have Marie-Ange André, part of the team. We have Dr. Berman Augustin. We also have Nadia Charles. We have Edward Seville and myself. As far as the presenters, the first one going to be Ms. Joanna Hernandez. Joanna is a registered nurse, like almost all of us are on the team. She is a Reiki practitioner, a certified dementia care manager. Her journey stems from caring for her grandfather with dementia. When she realizing the challenges, she shifted her focus to dementia care training and family education. She is also a transformative coach, meditation coach, and yoga instructor. Kind of put everything holistic into her training and coaching practice. Joanna continued her quest for knowledge and holistic care approaches at Jefferson Medical College on empathy. As of fall 2020, she also began mentoring students at Philadelphia College of Osteopathic Medicine. The second presenter is Mr. Michael Williams, whom you see on the panel, on the platform. He is a community outreach representative, facilitator for the Alzheimer's Association Caregivers Support, and a community educator as well. Michael worked in healthcare for over 30 years. Lots of knowledge, a wealth of knowledge, and retired in 2009 after his mother passed away in 2010, ending a nearly 15 years bout with Alzheimer's disease. He began to look for ways to help others who were experiencing what he had experienced. What a gift. In 2012, he officially volunteered to help the Alzheimer's Association. And in February 2018, he joined us at Jefferson, where he mentors healthcare people like the nursing, the pharmacy, occupational therapy, and medical students as well. He facilitated 2 weekly support groups, one in person, one virtual, for men only who are caring for the spouse and partner. You can tell from the reading that I just, took for you. So you have 2 people who are well knowledgeable of the Alzheimer's and dementia disease who are going to talk to you. Ms. Joanna, you have the platform. And thank you again.
Thank you for having me. Hi, everybody. So yeah, I have been volunteering for the Alzheimer's Association for a couple years now. I'm a community educator, so really enjoyed my time doing that. I'm going to be sharing my screen. However, I'm going to skip some slides for sake of time to try to keep it down to 30 minutes. So there will be some slides that I'll be skipping through.
Okay, so on va mettre slide pour nous, on va passer dans slide mais on va rater quelques na yo parce que nous capable save pour nous capable vivre dans 30 minutes.
Are you able to see my PowerPoint? It should say 10 warnings of Alzheimer's.
PowerPoint now.
Perfect.
Yes.
Perfect. Okay. So today we're going to explore the 10 common warning signs of Alzheimer's to help you be informed about what is normal aging and what is not normal aging.
Je,
Good.
Jodi, nous allons explorer ensemble 6 communs signes qui alertent nous de nous gen Alzheimer, une façon pour nous capable informer nous de le rentrer dans l'âge sans problème avec problème ou le rentrer dans l'âge en même temps.
By the end of today's program, the goal is going to be for you to be able to describe the typical age-related memory, thinking, and behavior changes. Recognize
Okay, go ahead. You can finish.
Recognize common warning signs of Alzheimer's and dementia. Go ahead.
Dans fin programme là, moi je veux que nous connaissions bio, c'est pour nous capables normalement décrire type de problème mémoire, pensée avec attitude, changement d'attitude, le nap grand monde, et puis reconnaître signaux qui montraient que il y a Alzheimer ou bien l'autre problème qui montrait que nous avons un déclin dans la pensée.
Discuss the tips of approaching someone with memory concerns. Explain the importance of early detection and benefits of diagnosis. Identify possible tests and assessments for diagnostic process. Name the resource available through the Alzheimer's Association.
Discuter point qui est pour nous approcher un monde qui a un problème concerne à propos de mémoire et puis expliquer l'importance pour nous capables détecter sa bonheur avec bénéficier un diagnostic bonheur. En même temps, identifier test qui gagne avec l'autre assessment qui parler de process pour diagnostic. Et puis, différentes ressources qui sont vers le bord qui est disponible dans Alzheimer Association.
Okay. So we're all here today to learn more about the dementia and Alzheimer's and identify common warning signs of the disease. You may have heard the term of dementia and Alzheimer's used interchangeably. They are related, but they're different completely definitions for them.
OK, nous là pour nous capables apprendre de 10 signes qui là pour alerter nous de Alzheimer, mais en même temps tout de ça que aurait les dementia que yo utiliser des fois utiliser yon pour l'autre, mais il y a une différence.
So first we're going to hear from Dr. Heather Snyder. She's going to discuss what is dementia. Please let me know if you can hear the video.
Premier, ça nous va regarder, c'est Dr. Heather Snyder qui va parler de Alzheimer. Fais-le connaître si nous sommes capables de voir des vidéos.
More than 100 years ago.
Hold on one second.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
Okay. Alzheimer's is the most common form of dementia, accounting for more than 80% of cases. Next, we're going to hear from Maria Carrillo. With her PhD, she is with the Alzheimer's Association. And she's going to discuss what is Alzheimer's disease.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
Okay. And then lastly, we're going to hear from Ruth Drew, the Director of Information and Support Services for the Alzheimer's Association, about the importance of recognizing the warning signs of Alzheimer's.
So, Dr. Ruth will parler de
important to know what the warning signs of Alzheimer's. It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with. Some of the things that can look like Alzheimer's may be other treatable conditions. If it is Alzheimer's, you still want to know as early as possible, because that gives the person and the family time to plan, time to make decisions, and it also gives the person with the disease a voice and allows them to say what they want.
As Ruth said, it's important to know what the warning signs are and to be on the lookout for these marked changes. The Alzheimer's Association.
I'm sorry.
So it's okay, go ahead.
Go ahead.
All right, the Alzheimer's Association, as a leader in this area, developed a list of 10 warning signs to help people understand the difference between normal aging and common signs of possible dementia.
So, li pral parler nous de 10 signes qui alertent nous de mon Alzheimer. So, ces signes ça là nous sur table sur panel là, on va discuter de chacun 10 là.
This list is intended to be only a tool to help identify unusual changes in a person's memory, thinking, or behavior.
Le sens ça, c'est seulement des exemples nous qui peuvent aider nous dans le diagnostic Alzheimer avec attitude mon qui a un problème Alzheimer.
It's important to know that this list does not constitute as a diagnosis of Alzheimer's or dementia. It's just simply the most common examples of changes that are experienced.
L'important pour nous connaître que l'ISA pas permettre que nous diagnostiquer Alzheimer, c'est seulement information.
Individuals may experience one or more of these changes in different degrees. Let's see what each sign is and what some of them are for typical age-related changes.
Nous allons voir qui ça signe ça et puis qui les signes tout qui montre normalité le on apprend.
Number 1, memory loss that disrupts daily life.
Moun qui perd du mémoire qui censé troubler et travail disons pendant journée chaque jour qui empêche chaque jour.
One of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information.
Yon nan signe qui alerte Alzheimer normalement dans début Alzheimer, c'est le moun nan commencer oublier.
Others include forgetting important dates or events, repeatedly asking the same questions, and increasingly
Oublier
relying
date.
on memory aids or leaning on others for things to
Oublier
add.
date. Y a répéter pareil yo de temps en temps.
A typical age-related change is sometimes forgetting information but remembering it later.
Yon signe typique de changement qui gagne dans normal, le moun nan ap grand moun normalement. Quelquefois, gen doit oublier yon information, mais après ça, on vient songer le plus tard.
Number 2, challenges in planning or solving problems.
Numéro 2, c'est difficulté dans planifier et en même temps dans résoudre problème.
Some people may experience new difficulties in executive functioning, including developing or following a plan or difficulty concentrating.
Il y a des gens qui ont un problème, qui ont une difficulté dans développer ou bien suivre un plan. Ensuite, disons, ils fait erreur, disons, occasionnellement. Le AP régler poser bill la caillou avec problème finance la caillou.
Conversely, a more typical age-related change is making occasional errors when managing bills or household finances.
Il y a un problème typique que mon grand monde des fois c'est quand on oublié pour le faire bill payer bill on doit oublier occasionnellement mais c'est pas tout le temps.
Number 3, difficulty completing familiar tasks.
Numéro 3, c'est difficulté que vous gagnez pour être capable de compléter des bagages que vous faites normalement.
People living with dementia often find it hard to complete daily tasks.
Mon qui vivent avec démentia plus souvent toujours trouver que vous avez difficulté pour compléter des bagages que vous faites chaque jour.
These could be things that used to be done easily, such as driving to a familiar place, writing a grocery list, or remembering how to play a favorite game.
Il y a des bagages, par exemple, conduire pour aller côté habitué à aller, écrire une liste pour aller dans la market, et puis songer comment pour jouer un jouet.
Conversely, a typical age-related change would be occasionally needing help to use a microwave or a remote. This could also include having trouble with new technology that the person hasn't had the opportunity to engage with as frequently.
Il y a un bagage qui arrive normalement dans le monde grand monde. Des fois, mon a une difficulté pour capable, disons, utiliser new technology, tant qu'on a un remote control, on va comme ça. Ça, c'est un bagage qui est normal pour mon grand monde.
Number 4, confused with time or place.
Numéro 4, les gens ont une confusion avec l'heure, avec côté, place.
An individual living with Alzheimer's or another dementia may lose track of dates, seasons, or the passage of time.
Il y a un monde qui vit avec Alzheimer ou bien un autre problème de déclin dans la parcelle qui est capable de perdre sens de l'heure, l'heure, date et puis saison qui a passé.
They may have trouble understanding something if it is not currently happening, or become confused about where they are or how they got there.
Yo kon gen problème des fois comprendre yon bagay qui a passé que yo pas arrivé comprendre. Et puis can you say that again, please?
Can I say it again? Yeah. They may have trouble understanding something if it's not currently happening, or become confused about where they are or how they got there.
OK. Yo gen doit gen problème comprendre yon bagay qui passe que yo pas arrivé comprendre ou bien côté yo qui côté comment on fait là.
This can become more dramatic or profound in the middle or late stages.
Il ka vin pi mal toujours, pi profond toujours dans disons dans mi-temps ou bien pendant dans stade qui dans mi-temps ou bien dans stade qui a fini dans Alzheimer.
A more typical age-related change could be getting confused about the day it is or when a scheduled appointment is, but figuring it out later.
Yon moun kap gran moun normalement quelquefois capable oublier schedule yon appointment, yon rendez-vous ou bien figurer ça plus tard. Mais li capable vin figurer l'après.
Number 5, trouble understanding visual images or spatial relationships.
Yo gen problème comprendre des images visuelles ou bien spatiales.
Some people with Alzheimer's or another dementia may experience vision problems, which can lead to difficulty with balance, trouble reading, and problems judging distance.
Gen de moun qui fait Alzheimer ou bien l'autre problème dementia, yo capable faire expérience des problèmes de vision qui cause que yo vin gen problème balance. Et en même temps, yo pas capable de juger de distance côté au aller.
They may also have problems determining colors or contrast, which can impact driving or navigating the environment around them.
Des fois, tout yo gen problème qui capable causer que yo pas continuer conduire ou bien aller dans l'environnement côté à cause de problèmes visuels que yo gen.
Vision changes such as cataracts are a more typical age-related change.
Yon moun kap grand moun, c'est yon nan problème yo capable gen c'est cataracte.
This sign shows us that these changes are not just about memory. It's important to think about all the other ways that someone's daily life may be impacted.
Changement ça yo montre que c'est pas seulement problème mémoire, mais l'important tout pour nous penser de l'autre bagaille, l'autre façon que moun nan qui capable causer difficulté dans la vie moun nan chaque jour à cause de changement ça yo.
Number 6, new problems with words in speaking or writing.
Numéro 6 là, c'est problème avec mots, parler et écrit.
Individuals may have trouble following or joining a conversation.
Moun sa yo capable gen problème rentrer dans une conversation ou bien continuer suivre une conversation.
They may stop in the middle of the conversation and forget what they are talking about.
Yo gen doit commencer dans mi-temps une conversation et puis yo oublier ça ou t'a parlé de.
And continuously repeat themselves.
Ensuite, tout temps, y a répété même bagay.
They might also struggle with finding the right words or calling things by the wrong name.
Yo en même temps, yo gen possibilité pour yo oublier, y a moment yo capable trouver mot que yo besoin qui pour sortir dans bouche yo ou bien pour yo relon bagay yon l'autre nom.
They may start using more descriptive terms to talk about something rather than the name of the actual item.
Yo ka peut-être décrit un bagay au lieu que yo joindre non bagay la pour dire.
A normal age-related change, however, will be occasionally forgetting or trouble finding the right words.
Yon nan bagay normal que yon moun kap grand moun genyen, cependant, c'est seulement essayer joindre right mot qui correct là pour yon capable dire. Ça c'est yon nan bagay yon moun kap grand moun, ça ka arrive moun nan occasionnellement. Que oublier yon bagay.
Number 7, misplacing things and losing the ability to retrace steps.
Numéro 7 là, c'est le ou mettez un bagay yon côté et que qu'on y a là, ou censé oublier comment pour trouver pour bagay la côté ou mettre là.
This sign often causes concern in people.
Ça a causé, signe ça rend moun qui autour de moun nan, ça m'a petit j'en fait le concerné, mon famille moun nan concerné à propos de ça.
I want to clarify that this is not about just losing your keys on occasions.
Moi, je voulais clarifier pour nous que c'est pas seulement, ça pas vraiment en rapport avec seulement si on perdu une clé occasionnellement.
Misplacing things from time to time is normal, but retracing steps to find them is a normal age-related change.
Mettez un bagay yon côté que ou pas qu'à songer, c'est un bagay qui est normal lié. Mais c'est là que ou pas qu'à rappeler de step pour gain pour faire pour joindre bagay là, c'est là le problème là.
A person with Alzheimer's disease may lose things and not be able to recall when it was last seen.
Yon moun qui fait Alzheimer, capable perdre yon bagay, et il vient pas capable rappeler qui dernière fois le te bagay.
They won't be able to identify the location where it was placed, or he or she may put things in unusual places, such as putting shoes in the refrigerator.
Yo pas capable même identifier qui côté yo te mette bagay là, ou bien en même temps tout, qui côté tant que si on mette yon l'autre côté yo pas rappeler de ça du tout tant que yo gen doit prendre soulier yo mette dans frigidaire par exemple.
Because of the lack of executive function and awareness, the person may grow increasingly suspicious of others and start accusing others of stealing and do so much more frequently over time.
Parce que mémoire yo pas vraiment présent, moun ça au fil du temps va développer suspicion côté que la va toujours mettre dans tête que mon a volé en fait.
Number 8, decrease or poor judgment.
Numéro 8 c'est déclin avec jugement moun nan qui vient moun nan c'est pas vraiment un jugement de réalité.
Individuals may experience changes in judgment or decision making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming.
Moun sa yo le plus souvent fait expérience changement dans la façon de juger, dans la façon de prendre décision. Tant que, par exemple, le jugement très pauvre, le deal avec l'argent, le moyen l'argent, et puis yo vin censé pas payer trop attention à l'hygiène, à façon de habiller, yo pas ça importance.
This can be especially common in the individuals who live alone.
Ça plus commun surtout dans grand monde qui vivent même seul.
Making a bad decision once in a while, such as forgetting to make an oil change, is more typical age-related changes.
Yon le conseil, yon moun kap grand moun, gen doit font décision qui pas bon. Tant que par exemple, alors ça son bagay qui yon le conseil, tant que par exemple, moun ta gen doit plier, changer l'huile dans la machine. Ça c'est un bagay qui normal pour moun kap grand moun capable plier.
Number 9, withdraw from work or social activities.
Numéro 9, c'est le moun a retiré le travail, ensuite li censé mettre la côté dans activité sociale qui gagne.
As we age, it's normal to feel uninterested by family or social engagements at times.
Pendant que nous grand monde, li normal pour nous capable des fois, disons, pas intéressé à activité sociale, familiale et quelquefois dans la famille.
However, someone who is experiencing dementia-related changes may start to lose their ability to hold or follow a conversation.
Cependant, yon moun qui a fait expérience dementia, et bien avec changement dans dementia, capable commencer perdre capacité pour le en conversation.
And as a result, begin withdrawing from social encounters or hobbies, they may lose confidence to engage in that way.
Et comme un résultat, ça vient faire que yo retire complètement de rencontres sociales avec l'autre monde ou bien activités que vous connaissez faire, vous venez censé détacher de ça. Et puis tout, vous êtes capable de perdre confiance, et puis vous êtes capable de vraiment engager dans façon ça.
Number 10, changes in mood or personality.
Numéro 10, c'est changement dans personnalité mon nan ak from the example.
Individuals with Alzheimer's or another dementia may become confused, suspicious, depressed, fearful, or anxious.
Il y a un monde qui fait Alzheimer ou bien l'autre maladie dementia, capable de une confusion, et puis yo déprimé, yo vin peur, yo vin anxieux, et puis tout yo vin suspect. D'accord, nous avons expliqué tout à l'heure.
They might get easily upset either at home or when out of their comfort zone.
Yo facilement vin censé fâché, yo upset. Et puis yo que c'est la caillou, que c'est les ou pas la caillou.
As we age, however, it's normal to develop very specific ways of doing things and becoming upset, irritable when a routine is disrupted.
Le nap grand monde est normal, quelquefois pour nous capable développer des façons qui nouveau qui différents et en même temps tout le monde est capable venir très fâché ou bien li pas content, le par exemple routine ça que vient mettre en petit genre. Mais ça son bagage normal pour le nap grand monde normal.
Someone with Alzheimer's or dementia may become fearful, angry, or easily frustrated, which is something that we should address.
OK. Moun qui souffre Alzheimer ou bien dementia, capable vin très peur et puis li réellement ka fâché en pile et puis li frustré pour n'importe qui bagay et que moun sa yo c'est des bagay que nous devons adresser parce que il va mourir.
Alzheimer's.
The other thing.
Way I
One of the most another
The importance of early detection. This is our next topic.
Important pour nous capable détecter bonheur, ça nous va le voir.
It's key that we pay attention to what's going on with our own cognitive health and not dismiss any changes that we may be experiencing as normal aging.
Il est important pour nous capable porter attention à ce qui a passé dans pensée nous et en même temps pour nous pas mettre le de côté pour nous pas négliger mais pour nous pas négliger les changements qui gagnent que nous avons fait expérience ça pour nous pas mettre pour ça son bagage qui normal.
Any change that's unusual for your level of functioning or that of someone around you is a cause for concern.
C'est un bagage pour nous porter attention à lui, n'importe changement qui pas normal que nous voyons dans la façon que nous fonctionner, nous devons porter attention à lui. Ou bien un monde dans la famille, un monde qui est aux alentours, nous qui pas fonctionner normalement.
Many times, friends and family are the first to notice changes in someone's memory, behavior, or other abilities.
Le plus souvent, ses amis, famille, il y a un monde qui est capable de noter changement ça que le monde n'a gagné dans lui.
In this module, we'll discuss why it's critical to address any observed changes early and seek answers from a medical professional.
Dans partie ça, nous allons discuter de qui ça qui critique que nous devons adresser dans ça que nous observons, changement que nous observons et chercher aide chercher réponse de la part de yon monde qui travaille dans le médical, un professionnel médical.
Sometimes the person exhibiting symptoms is not aware.
Des fois, yon monde qui gagne un symptôme ça yo pas rendre compte de ça.
Or may not have the insight to know that they are experiencing changes, which is why having outside perspective is critical.
Et des fois, yon ne doit pas comprendre que yon gagne un changement qui a fait expérience. Et c'est ça qui fait que c'est important. Moun qui aux alentours, moun ça doit porter attention à ça. C'est important.
This is especially important for individuals who live alone or are far from family and friends.
Ça important pour moun qui vivent même seul, avec pour moun qui vivent loin famille ou amis.
Let's listen to Dr. Soloway discussing this, and then hear from a care partner who was the first to notice changes for her husband.
Nous allons écouter Dr. Soloway qui va discuter de ça, et puis de Mary qui t'a fait expérience là avec Marie.
You know, it's a very interesting phenomenon that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, you know, if they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, you know, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
If you continue to observe these changes, it's critical that you plan to take the next step and have a conversation with the person or others close to him or her about what you've noticed.
Si nous continuons à faire observation changement ça, c'est réellement important pour nous planifier qui ça n'a fait pour nous suivre mon ça et faire une conversation avec mon ou bien avec mon qui tout près de famille et pour nous voir exactement comment on a fait ça, comment on a continué, qui prochain pas nous va le faire.
This can be difficult or uncomfortable conversation to have.
Ça, c'est un bagage qui est capable, son conversation qui est capable très difficile et mon n'a pas confortable là-dedans.
The Alzheimer's Association has developed a roadmap of 10 helpful steps to help make addressing memory concerns less daunting and more productive.
Association Alzheimer a développé 10 points qui sont capables d'aider le nous gagner problème avec mon famille nous qui a un problème mémoire. Pour nous capables d'adresser.
First, you start by assessing the situation.
nous commencer par investiguer qui problème ça est.
Next is step 1. What changes in memory, thinking, or behavior do you see? What is the person doing or not doing that's causing concern?
Premier ça nous c'est qui changement dans mémoire, dans façon mon a pensé, dans façon la agir que nous voyons.
What else
Ça
is
mon
going
a
on?
fait ou bien pas fait qui cause que nous avons un problème avec ça.
Number 2, what else is going on? Various conditions can cause changes in memory, thinking, and behavior.
Numéro 2, c'est qui ça vraiment qui a passé là? Qui différentes conditions qui sont capables de causer que mon n'a perdu mémoire. Penser avec attitude, l'autre attitude. Est-ce que il y a l'autre problème ou bien l'autre problème de santé qui est capable de causer, qui est capable de contribuer que mon n'a gagné ça, changement ça?
Are there other health or lifestyle issues that could be contributing to these changes, such as stress, diabetes, or change in medication?
Est-ce que stress, diabète ou bien changement de médicament capable de causer problème ça ou avec l'autre problème santé?
Number 3, learn about the signs and benefits of early diagnosis.
Numéro 3, c'est apprendre différents signes avec bénéfices que nous sommes capables de joindre le diagnostiquer le bonheur.
You've already taken the very first step by joining us for this program tonight and to learn about these topics.
Premier pas qu'on fait, c'est rentrer dans le programme, dans la conversation ça que nous gagnons à soir pour être capable de discuter de topic ça.
Do you notice any of these signs in a person you're concerned about?
Est-ce qu'on note signes ça yo dans le monde qui aux alentours de vous-même là?
Has anyone else noticed the changes you observed?
Est-ce que y a l'autre monde qui note changement ça yo que vous-même vous voyez?
Talk with friends and family. What, if any, changes have they noticed?
Parler avec famille, avec amis, qui est dans signe ça yo, dans changement ça aussi gain n'importe ça yo gain que yo même tout yo observer.
Next, prepare to have the conversation.
Prochainement, c'est préparer nous pour une conversation.
Who should be the one to discuss concerns with the person?
Qui est ce monde qui doit faire conversation ça avec moi?
It could be with you, a trusted family member, or a friend, or a combination.
Li capable ou même, yon moun ko fait confiance, yon ami, ou bien tous les deux.
It's usually best to speak with one-on-one that the person doesn't feel threatened or ambushed, but use what you know about the person to judge what approach might work best.
Li mieux que nous parler avec moun nan, yon un à un, you know, un à un, yon façon pour moun nan pas sentir inconfortable et en même temps tout pour pas penser que nous allons dans trap.
Next, number 6, when and where should the conversation be held?
Numéro 6, c'est qui côté et qui le nous devons faire conversation ça.
It's important to have the conversation as soon as possible.
L'important pour nous faire conversation ça.
In addition to identifying a date and time, you should also consider where the person will feel most comfortable.
Donc, nous finissons choisir date là, nous finissons choisir l'heure. L'important tout pour nous capables considérer qui côté moun nan a plus confortable conversation en fait.
Number 7, what will you or the person having the conversation say?
Numéro 7 là, c'est qui ça ou même ou bien moun nan qui pral faire conversation ça, qui ça nous pral dire?
You might want to build out somewhat of a script considering the following questions.
Nous capables écrire des bagailles que nous capables dire, écrire pour nous capables parler.
I've noticed changes in you, and let them know what the changes are. And I am concerned. Have you noticed this?
Moi, remarqué changement dans vous-même et ça, un petit genre, pas un problème. Est-ce que vous-même tout, ou est ça, bon côté pauvre?
Are you worried? How have you been feeling lately? You haven't seemed like yourself.
Est-ce que, comment sens-tu, sorry. Ou pas semblé que vous-même, quand vous n'avez pas attitude qu'on baille là par vous-même, est-ce que vous sentez comme ça tout?
I noticed you. Let them know the example of what you noticed, and it worried me. Has anything else like that happened? So you're going to let them know about an occasion.
Yeah. Ou capable de chercher une occasion côté que nous ouais mon nan bagay li fait qui pas normal et puis nous capable adresser ça avec mon nan et puis faire mon nan connaître que c'est un bagay qui réellement que nous tient à cœur que nous devons aider là avec lui. Est-ce que y a l'autre bagay qui rive?
Number 8, offer with the person to the doctors.
Numéro 8, c'est offrir mon nom pour mener le cas docteur.
Ask the person to see a doctor and offer to accompany them. Try using encouraging words.
Mandez mon nom pour capable mener le cas docteur et accompagner nous-mêmes. Essayez d'utiliser des mots encourageants.
You can use words or statements such as, there are lots of things that could be causing this. Let's see if a doctor can figure this out.
Yeah, nous capables d'utiliser des mots ou bien des phrases tant que par exemple, il y a un pile bagay qui capable poser ça. Donc on a loué si un docteur capable de nous figurer problème là.
The sooner we know what's going on, the sooner we can address it.
Puis bonheur nous connaît ça cap poser problème là, puis bonheur nous capable adresser.
I think it will give us both peace of mind if we talk to a doctor.
Ça capable aider nous calmer nous si nous aller cailler un docteur.
Number 9, if needed, have multiple conversations.
Numéro 9, au besoin, pas hésiter faire plusieurs conversations avec mon nom.
Don't be discouraged if the first conversation is not a successful one.
Pas décourager si première conversation pas.
Write down notes about how it went so that you can prepare for any future conversations.
Écris note pour nous connaître comment conversation ça t'est allé, pour nous capable référer nous dans prochaine conversation que nous avons gagné.
Don't dismiss the changes you're noticing simply because the person is reluctant to address them or the conversation didn't go as planned.
Pas négliger changement que nous notons seulement parce que mon nan un petit genre pas vle rentrer dans conversation avec nous. Pas négliger ça du tout.
Next, reach out for support.
Prochainement, nous chercher aide.
Number 10, you can turn to the Alzheimer's Association, call our free 24/7 helpline to talk with the master level clinicians.
Nous capables relais association qui fait Alzheimer yo pour plus d'informations, yo gen numéro toll free que yo utilise 24/24 7 jours sur 7 qui capable aider nous et puis joindre yon monde qui capable aider dans santé qui capable aider nous avec qui capable faire nous joindre support avec information.
They can provide you with reliable support and information, including about how to find the important conversation.
Yo capable aider nous comment pour nous capable faire les conversations que nous voulons faire. Ça qui est important.
Finally, see a doctor.
Finalement, aller un docteur.
Most people address concerns about memory, thinking, and behavior with their primary care physician first.
En pile moun adresse problème ça ou que gagne avec alors problème pensée, problème mémoire, problème changement d'attitude avec docteur, primary docteur.
However, in some cases, the primary care physician may refer them to a specialist for further evaluation.
Cependant, primary docteur est capable de référer nous à un spécialiste pour plus d'investigation.
Examples of the specialists include a geriatrician who has additional training in medical care for diseases and conditions common among older adults, generally over the age of 65.
Spécialiste capable gagner gériatrique, monde qui est responsable gériatrique et qui gagne des training additionnels dans soins médicaux pour monde qui gagne pour adultes grand monde qui dépasse 65 ans.
Neurologists who specialize in disease of the brain and nervous system.
Neurologue qui spécialisé dans maladie cerveau avec système nerveux.
It's important to note that not all neurologists specialize in Alzheimer's and other dementias.
Il est important pour nous connaître que c'est pas tout neurologue qui est vraiment spécialisé dans Alzheimer avec dementia. On connaît ça tout.
Neuropsychologists who can assess, diagnose, and treat psychological disorders associated with brain-based conditions.
Nous capables tout un neuropsychologue qui spécialisé dans problèmes qui traite problèmes psychologiques des autres psychologiques que nous capables gagner qui en rapport avec avec cerveau, conditions du cerveau.
Psychiatrists who specialize in disorders that affect mood or the way the mind works.
OK, psychiatre qui est spécialisé dans problèmes et tempérament avec la façon en même temps de penser nous fonctionner.
And psychologists with special training in testing memory and other mental functions.
Psychologue qui gagne des training spécial dans tester mémoire et avec l'autre problème mental, avec l'autre fonction mentale.
We know the signs, we know what signs to look for and how to approach the conversation. Now let's discuss the early detection.
Qu'on y a nous connaît qui signe pour nous garder, pour nous chercher et comment pour nous approcher avec conversation nous yo. Qu'on y a nous va discuter de bénéfices pour nous capable détecter maladie sans bonheur.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
Now let's take a look at what may be involved in the medical process to determine the cause of symptoms.
Konya la nous pral regarder qui ça qui capable qui capable involve dans process médical que a faire pour capable déterminer cause avec symptômes maladie.
We're going to test the knowledge.
On va checker ça nous connaît.
There is currently no way to diagnose Alzheimer's disease.
Présentement, pas gagné aucune façon capable de diagnostiquer maladie Alzheimer. Est-ce que c'est vrai ou bien est-ce que c'est faux?
So at one point, this used to be true. You couldn't diagnose it until autopsy, but that changed many years ago. This is false.
Ça, c'est faux. À un certain point, yo pas capable de faire li, mais qu'on y a là, yo capable de faire li, parce qu'il y a un pile test avec assessment qui possible.
There are a number of assessments and tests that can make it possible for healthcare professionals to diagnose Alzheimer's and dementia with high degree of certainty.
Gagner un pile test avec assessment qui est fait qui rend possible pour capable diagnostiquer maladie Alzheimer et qui vraiment high standard. Sorry.
However, determining the cause of dementia can sometimes be more difficult.
Cependant, déterminer cause maladie à dementia capable plus difficile.
Here, we're going to explore possible steps of the diagnostic process.
Là, nous allons explorer différents tests avec assessment qui aident dans le diagnostic.
Keep in mind, as we review these steps, not everyone may be asked to undergo each one by their doctor.
N'a essayé songer surtout pendant que nous prenons dans chaque step yo que c'est pas tout step que nous prenons demander pour nous capable faire et docteur nous prenons demander nous pour nous capable faire.
Assessments may include medical history, physical exam, a screen for depression, and interview with close companions.
Dans assessment là on peut trouver histoire médicale moun nan, examen physique li, screen qui on fait pour détecter dépression dans moun nan avec interview avec yon moun qui close et moun nan.
Tests may include laboratory tests, mental cognitive status tests, and brain and imaging.
Test qui est capable d'inclure là-dedans, c'est tests qu'on fait dans le laboratoire et puis des tests qu'on fait pour détecter mental, connaissance mentale, statut mental, avec image du cerveau qu'on vient pour faire, avec liquide cérébrospinal.
Do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia?
Est-ce que yon moun qui présente des symptômes tant que si moun nan gen dementia, est-ce que li toujours présent, li toujours résulté dans un diagnostic? Est-ce que yo ba moun sa yon diagnostic de Alzheimer? Le ça arrive.
The diagnostic process may vary from person to person depending on individual's specific situation and what the doctor feels is the right course of action for that person.
Diagnostic là varie de moun à moun. Ça tout dépend de moun situation spécifique que moun la donné ou bien sa docteur a senti qui c'est cours normal puis bon pour moun action pour le faire pour moun. Ça dépend du docteur.
The diagnosis may be something other than the Alzheimer's or another dementia, which is why it is important to investigate the cause of symptoms.
Diagnostic là capable yon bagay qui différent de Alzheimer ou bien yon l'autre dementia. Et c'est ça qui fait que c'est important pour yon capable investiguer cause là, avec cause symptômes là.
Stigma and misconceptions of Alzheimer's, like nothing can be done, can deter some people from seeking diagnosis.
Taxer moun nan, ou bien mauvaise conception de maladie Alzheimer, des fois, il doit causer que moun nan pas même chercher aide.
Someone could
The Alzheimer's Association is in communities across the country, providing direct services to individuals and families facing the disease.
Association Alzheimer, c'est une association qu'on trouve dans tout le pays, et c'est une association qui baille service direct à moun avec famille moun qui a un problème maladie ça.
The association is available everywhere and whenever you need reliable information and support.
Association disponible tout côté et n'importe le besoin information avec support qui est nécessaire.
3 of our key resources that can connect you to information and support include
Ressources qui capable connecter avec information ça ou gain 3 nan.
our free 24/7 helpline,
numéro téléphone helpline hein, qui là 24/24 7 jours sur 7.
you could call day and night and receive information and support.
Ou capable reler à soir, matin, la journée et puis ou joindre support.
Provides access to highly trained and knowledgeable staff who can help with education, decision-making support, and crisis assistance and resource identification.
Li ban nou accès à des moun qui connaît et qui train dans cas maladie ça. Et en même temps des moun qui capable aider nous ban nou éducation dans décision que n'a prend pour nous faire support à moun yo et dans toute et puis capable ban nou assistance dans toute crise qui capable gagner avec ressources pour yo capable identifier ressources qui bon pour nous.
Master level clinicians are available around the clock to provide in-depth care consultations free of charge. Care navigation services offered to families at any stage of the disease.
Ou gagner des moun qui vraiment qui maîtrise, des cliniciens qui maîtrisent pour capable aider et faire nous joindre 24/24 toute information que nous gagnons, consultation et puis on pas charger nous pour ça. Son bail qui gratis pour capable aider nous dans différents services que offre famille dans n'importe stage maladie.
Help is available in over 200 languages.
Yo gen aide qui disponible dans plus que 200 langues.
Next is our website, ALZ.org.
So website yo c'est ALZ.org.
Often the first stop for individuals following a diagnosis of Alzheimer's or other dementias.
So le plus souvent c'est premier step que moun nan fait c'est aller online pour aider chercher aide dans diagnostic Alzheimer avec l'autre dementia.
This includes other sections specifically for people living with the disease. ALZ.org, I have Alzheimer's. I have ALZ.
Il y a une section là-dedans qui spécifiquement pour moun qui vivent avec maladie. Et section ça c'est ALZ.org et puis have ALZ. Donc c'est ça.
And for caregivers, ALZ.org, alzheimer.org/care.
Et pour moun kap pran soin moun sa yo, c'est alz.org/care.
And lastly, the Community Resource Finder.
Et finalement, ressources pour nous capables de joindre, alors, community, ressources dans la communauté yo, que nous, pour nous capables de joindre.
A wealth of community-based resources available in your area.
Gen en pile ressources communautaires que nous capables de trouver dans l'area pa nou, qui disponible dans l'area pa nou.
This is including long-term care, community-based services, and local association offices.
Ça inclut soins à long terme, des services communautaires, et puis il y a des bureaux d'associations locales que nous sommes capables de trouver au Ladani.
All right. So if you have a pen and paper, you can write down this phone number. You can look it up online also. You can call anytime. This is available to everyone.
Si nous avons un bic avec papier, écrit numéro ça yo, écrit website là tout, et puis nous sommes capables de joindre une réponse à toutes les questions que nous avons. Nous avons n'importe qui nous parle avec lui.
Okay, thank you very much. I will stop presenting.
Merci en pile.
Oh. Now we're going to step into the second part of the presentation with Mr. Michael Williams. Thank you.
Good evening, everyone.
Bonsoir tout le monde.
All right, I'm going to be talking about understanding Alzheimer's and dementia.
Li pral ba nou compréhension de Alzheimer's et dementia.
As was mentioned earlier, so my name is Michael Williams. I have been with the association for about 12 years. I was a caregiver for my mother for 15 years.
J'ai été mentionné avant, et il a travaillé pour l'organisation depuis 12 ans, et il a occupé maman ni pendant quelques temps.
What we're going to talk about today or this evening comparing Alzheimer's and dementia,
comparer Alzheimer's avec dementia,
recognize how Alzheimer's disease affects the brain,
qui c'est des facteurs qui affectent brain nous dans Alzheimer qui souffrent Alzheimer's disease.
List the risk factors of Alzheimer's disease.
Oui, on va lister les risk facteurs que c'est des agents prédisposés.
Identify the stages of the disease.
Nous allons identifier différents stages, différentes étapes de maladie.
And describe how scientists are working to advance research.
Et nous allons parler tout qui gens scientifiques à travailler pour avancer dans la recherche sur maladie ça.
And we're going to recognize current FDA-approved treatments.
Et nous allons parler tout de traitements qui organisation, bon, ici, le FDA, qui reconnaît traitement pour maladie ça.
And we're going to talk about the resources available through the Alzheimer's Association.
Et nous allons parler tout de ressources qui a disponibilité nous pour mon qui souffre avec maladie ça.
You may have heard people use the words Alzheimer's and dementia interchangeable, but they are not.
Oui, mais nous, il y a une possibilité que nous entendions que le monde qui utilise, eh bien, Alzheimer, more Alzheimer's disease ça avec dementia et dans place yon l'autre.
The word dementia is like the word cancer.
Mot dementia, c'est comme si c'est pour un monde qui entendait mot cancer.
There is more than one type of cancer. There is more than one type of dementia.
Il y a différents types de cancer et puis il y a différents types de dementia.
Okay. Alzheimer's is just one type of dementia.
Alzheimer's, c'est un type de dementia.
We're going to test your knowledge.
On va tester connaissance nous.
Alzheimer's is a normal part of the aging process. True or false?
Question, c'est Alzheimer's, est-ce que c'est un bagage normal qui fait partie de l'homme on a entré en âge? Question, est-ce que les faux ou bien les vrais?
It is false.
Réponse là, c'est fausse.
Alzheimer's is a brain disease that causes problems with memory, thinking, and behavior.
Alzheimer's, c'est une maladie qui n'a brain qui pose des problèmes avec mémoire, pensée.
It is not a normal part of aging.
Elle n'est pas une action normale de l'entrer en âge.
Next question.
Prochaine question.
People younger than age 65 can get Alzheimer's. True or false?
Moun qui moins de 65 ans, est-ce que vous avez gagné Alzheimer's? Question, est-ce que c'est vrai ou bien est-ce que c'est fausse?
That is true.
Oui, question.
Alzheimer's is much less common.
Alzheimer est moins commun.
People younger than 65 can also develop Alzheimer's.
Moun qui plus jeune que 65 ans capable de développer Alzheimer's.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning.
Dementia, c'est une sorte d'umbrella, c'est un terme qui couvre et un problème de mémoire et problème de pensée.
There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the
Wow. There's different types of dementia. Bon, baguette, il va aller très vite, baguette saisi premier commencement, mais des différents types de dementia qui ont été mentionnés pour nous dans le slide là avant ça. Et même capable de dire Alzheimer's, vascular, pendant que la paix remettre les encore. Alzheimer's vasculaire. So, c'est Alzheimer's avec problème et bon, capable de dire, dans circulation.
Which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein.
Bon, gen yon protein nan sa yon le Alzheimer's Lewy body ya, donc c'est yon qui souffre de un manque de protéine qui gon gros non la don, qui gon gros non, baguette à saisi.
That include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
Chaque type de dementia gen différents parties qui affecté. Dans la liste nous sodoya, gen frontotemporal qui affecté devant capable dire avec dans zone brain là, mais gen différents mix dementia tout qui nous te parlé de ça avant ça.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles.
Formation of plaques and tangles. D'après que le docteur Alzheimer te déclaré qu'il y a différents changements qui fait dans le brain, il y a des plaques qui rejoignent dans le brain.
Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory.
Mais c'est une maladie qui a progressé mais qui cause un problème de mémoire.
Thinking and behavior.
Donc, un problème en mémoire, pensée et attitude, comportement.
The brain has three main parts: the cerebrum, the cerebellum, and the brainstem.
Brain a trois parties. The cerebrum, cerebellum, what was it?
Brainstem.
And brainstem. Bon, comment on traduit brainstem? Wow. Bon, capable branche. Bon, pas traduire brainstem, non?
Ça, le tronc cérébral, là, c'est pour qu'il y ait trois parties. Ça, le cerveau, ça, le cerveau, là, avec partie qui est liée avec moi, l'épinière.
Merci, Dr. Berman. Mon Dieu, faut dire là.
Okay.
Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die.
Want to take it over?
Go ahead.
Oh, can you play that again?
Sure.
Please?
Non, il dit que chaque partie dans le cerveau joue un rôle dans Alzheimer. Mais Alzheimer à lui-même, ça le cause, c'est destruction cellule qui dans le cerveau qui cause. Sorry, je continue qui est tellement faible là.
Sorry, Mr. Michaels, you can keep going.
Okay.
Disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
Donc, il y a tout bagay sa yo, li attaqué, nous connaissons qu'il attaqué mémoire, pensée, les gens comportement yo, et à la fin, li affecté comment il est capable de valer.
Okay, the risk factors for this disease.
cause prédisposée, raison prédisposée qui a cause maladie ça.
Let's see if you can guess what's the most common risk factor. I'll give you a list of choices.
Maintenant, regarder connaissance non pour voir qui est y en a cause ça yo qui a prédisposé à maladie ça.
What is the greatest known risk factor for Alzheimer's disease?
Qui ça qui plus gros risque plus gros cause prédisposé qui a causé Alzheimer's là. Il va ba nous trois raisons.
The most greatest known risk factor is age.
L'âge c'est un plus gros facteur qui est capable de cause maladie ça.
Okay. Although Alzheimer's is not a normal part of aging, the age is the greatest risk factor.
Crois que l'âge pas un risque pour Alzheimer's, mais l'âge là tout. Can you say that again? After age. Can you say that again?
Although Alzheimer's is not part of normal aging, age is...
Crois que Alzheimer's n'est pas fait partie de âge de partie de non l'âge avancé ou?
Yeah, the age is the greatest risk factor for the disease.
Mais l'âge là c'est un plus gros risque pour maladie ça.
After age 65,
après l'âge 65 ans,
the risk of Alzheimer's doubles.
Risque pour gagner Alzheimer's là li doublé.
Every 5 years.
Chaque 5 ans.
34%.
34%
of people 85 and older
de monde qui a 85 ans et puis ou toujours
have Alzheimer's.
Gain Alzheimer's.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That
Alzheimer's marqué avec différents changements qui gagnent dans le brain.
is changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal.
Gain changement dans pensée nous et dans comportement nous et puis en gens nous agit. Mais ultimement, c'est une maladie qui est fatale.
And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk.
Cause yo so pas fin connaît mais quelques risques yo anticipé.
Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65.
L'âge c'est un risk factor que nous disons qui cause maladie.
However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research
Histoire capable dire hérédité c'est une cause qui est capable causer maladie ça.
Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease.
So, monde qui te gen famille qui nan race nan famille qui te gen ou gen plus risque pour capable gen tout.
And that risk increases if more than one family member has Alzheimer's. When we talk about the
ou plus prédisposé pour gen si plus que yon monde nan famille ou te gen déjà.
Genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes.
Bon, yo dit gen deux différents gènes, gen génétique, ça c'est ou fait avec l'un, et puis on l'autre yo relé gène qui a déterminé maladie.
Risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
Gene familial là, pas carrément déterminé que wap genyen, mais gène, ça est déterminant, est capable plus déterminé, appuyé que wap genyen, que wap faire Alzheimer's, wap faire maladie.
Populations at higher risk.
Population qui gen plus gros risque, qui prédisposé pour gen maladie ça.
People of African descent are twice as likely as white Americans to have Alzheimer's or other dementia.
À moun qui descend d'Afrique, gen double chance, deux fois gen chance pour capable gagner que moun qui blanc.
Hispanics are 1.5 times as likely to have the disease as whites.
Moun qui d'origine espagnole yo capable gagner une fois et demi plus que blanc américain.
Almost 2/3 of Americans living with Alzheimer's are women.
Il y a plus que 2/3 deux tiers de Américains qui gagnent et c'est filles que yo.
So if you are a woman of African descent, your chances of getting this disease are extremely high.
So c'est son fille qui de descendance africaine, donc il y a plus de chance pour gagner maladie ça.
We're going to talk about the stages of the disease now.
On va parler de stage, d'étape maladie, Alzheimer's là.
I'm like an overachiever and when you're unable to deliver or you're not performing at the same pace that you once did before.
Math, I can't do a simple tip anymore.
Dame qui t'a parlé avant, son dame qui dit que lui aime exceller dans sa la fait, donc
I can't.
Et même lui dit que même mathématiques que le pas qu'à faire deuxième monsieur ça.
Math,
I'm like an overachiever and when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not replace things. It's frustrating.
I can't do a simple tip.
Yeah, li baga faire un simple mathématique. Même tip li pas capable bay.
I sit there, I stare at it. It's crazy what numbers I can't deal with anymore.
Yeah, li pas
and in some ways,
ways,
that's the disease to me. The other thing that I've increasingly been struggling with are words.
Yeah, li pas jamais gen problème pour parler. Bagage un mot pour parler.
Dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer.
Donc, monsieur Sal, il dit que problème li, bon, il qu'on lit, c'est un journaliste, qu'on fait rapport, il pas capable de faire ça comme ça.
Alzheimer's disease is a continuum.
Maladie Alzheimer's, c'est une maladie qui a continué.
Initially, There is no symptoms. You can't tell the person has it.
Au commencement, il n'y a pas aucun symptôme, il n'y a pas aucun symptôme.
However, biological changes have started in the brain.
Cependant, au style commence à gagner des changements biologiques qui a fait.
Research has shown
Recherche montré
that changes start in the body
que le changement commence dans le corps, nous,
approximately 5 to 10 years
5 à 10 ans
before any symptoms are seen.
avant symptômes de paraître.
All right. The next stage is called
L'autre étape là,
MCI, mild cognitive impairment.
Changement dans la pensée, nous, dans la compréhension, nous. Et, mais l'autre gens marde, l'autre gens et il pas gros, mais il est assez can't find that word. Il pas gros, mais il est assez, il pas énorme, mais il est assez, il un petit genre attire l'attention.
And from there, the person progresses
Et après ça, on a commencé à progresser.
To dementia due to Alzheimer's disease.
Et la entrée dans la dementia qui est associée avec Alzheimer's disease.
And within that area, there are 3 stages.
Et dans la zone ça, dans la partie ça, il y a 3 étapes là-dedans.
All right, your mild stage, which involves symptoms that interfere with daily activity.
So, gen ça qui est mal là, ça qui est anti-jambe beaucoup sévère, ou capable de réagir sur l'activité normale de journalière ou chaque jour qu'on a fait.
And it progresses up to very severe, where your person cannot do too many things at all.
Et la progresser dans une zone qui parle plus sévère, que on n'a pas faire aucune activité du tout.
FDA approved treatments.
Quelques traitements que l'organisation FDA a approuvé.
There is no cure for Alzheimer's.
Pas aucune cure, pas aucune réellement cure pour Alzheimer's, pour maladie ça.
It is a fatal disease.
C'est une maladie qui est fatale.
You will die from Alzheimer's.
Ou mourir de maladie ça, de Alzheimer.
Current medications cannot cure Alzheimer's.
Un médicament qu'on y là, il pas qu'à résoudre le problème Alzheimer's. Hein?
But there are treatments that change the disease progression.
Mais il y a des traitements qui ont changé progression maladie.
There are also drug and non-drug options.
Un médicament et aussi l'autre option que on est capable de gagner.
That may help treat symptoms.
Qui doit aider traiter symptômes.
Such as memory loss and confusion.
Pour mémoire avec confusion.
However,
cependant,
these treatments only work for some people some of the time.
Traitement ça va marcher pour quelqu'un quelquefois.
There is no treatment that works for everybody.
Pas un traitement qui travaille pour tout le monde.
Treatments may be administered as a pill, patch, or an intravenous.
Médicaments capable administrer ou en graine ou en sorte de patch que vous mettez sur ou bien injection intraveineuse. Cap passer dans veine, non?
Okay. These treatments work in varying degrees and are not effective for everyone.
Traitement ça yo travail dans des différents degrés, mais yo pas aussi effectif pour tout le monde.
have a conversation with a healthcare professional
Puis avoir une conversation avec un monde qui travaille dans la profession en santé pour
to determine whether a treatment is appropriate for you.
capable de déterminer un traitement spécifique pour vous-même qui est approprié pour vous-même.
And you can also go on the Alzheimer's website,
So nous
alts.org/treatments.
Nous capables d'aller sur le website ça yo, dans sa computer nous, dans le téléphone nous, dans ALZHEIMER.org et puis / traitement.
Clinical studies are very important to advancing Alzheimer's research.
Recherche qu'il y a fait sur Alzheimer's pour traitement très important.
Participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And
Une façon que vous capable participer, vous capable aider, vous capable participer dans la recherche ça yo qu'il a fait sur maladie.
For people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
Donc, il est bon, bon pour participer dans la recherche, ça yo, vous capable de joindre des traitements qui sont capables d'aider.
You might hear the phrase negative trial, which means it didn't hit the endpoint. It didn't result in an FDA-approved treatment for the disease. But I think the only negative trial is one that doesn't provide us with valuable information.
Negative trials, quelques fois, vous parlez de ça, mais c'est pas toutes les fois. Negative trial, là, il y a un résultat que vous avez cherché.
All research does not involve taking medication.
Toute recherche n'est pas impliquée pour un médicament.
I am currently involved in a research at University of Pennsylvania.
Mr. Michael Williams, il a participé dans la recherche à l'University of Penn, à l'hôpital University of Penn.
There is no medication involved.
Pas de médicaments que la prend.
And it's a 4-year study.
C'est une étude qu'il a fait pendant 4 ans.
In order for them to find a disease to help those of us of African descent, we need to get involved in research.
So, il encouragé et pour moi participer dans la recherche, dans l'étude scientifique ça yo.
And here's our phone numbers and online, same numbers that Joanna gave us.
Okay. So, nous avons un numéro ça déjà, que Ms. Joanna te baille déjà. Donc, si nous ne pouvons pas écrire, nous avons écrire qu'on y a. C'est 800-272-3900.
Mm-hmm. And that's it.
And that's it, folks. Thank you, Mr. Williams.
Hopefully I made it a little easier for you.
Yes, thank you. Appreciate it.
Thank you so much. M'pa faire un paquet rale vini. Ça m'a demandé nous pas poser questions. Mais moun qui capable yo dans chat là tant pris écrit non seulement avec zip code non. Nous connaissons que son gros association Alzheimer côté que il faut que yo montrer travail que y a fait. Donc yo ouais nan qui différents zip codes que yo servi. Donc tant pris al dans chat là commencer mettre questions et plus précisément mettez zip code non avec non. Nous capable ouvrir téléphone nous pour nous poser questions, n'a prend question et dans moment ça nous capable moun qui pas parler yo nous capable ouvrir et poser questions. So we are waiting for some questions right now. At this moment, Miss Joanna Hernandez and Mr. Michael Williams are ready for your questions.
Well, I guess, may I ask the first question, or shall I still go in the chat?
No, you can ask.
Okay, thank you. My question would be, I know you mentioned the statistics regarding the women. Do you have any input on the male percentage with the Alzheimer's? I know we started about the women, you know, having the increased risk.
Right. No, to my knowledge, there is no statistics involving men. They're just saying that because in the United States, approximately 2/3 of the people with Alzheimer's are women. But
okay. Thank you. Donc, question dans cette table mandeli, est-ce que vous connaissez une sorte de pourcentage sur combien de garçons qui sont capables de gagner, mais ils disent non, pas qu'il y a information ça. C'est plus Sophie que vous avez parlé, qui gagne plus risque, capable de gagner maladie Alzheimer ça. I don't know if Joanna had anything to add? I think you
no, I just know that it's definitely more pertinent in like African Americans and people of color in general.
Thank you.
Si nous entendez bien, nous voyons que équipe ça qui sur plateforme là, nous presque sujet avec maladie ça. Ça pas dit que nous pas le gagner, mais les bons à ce que gon question, merci pour vos présentations ça, sa question Pam. C'est Julie, tu me tournes back là-dedans. Il paraît que le chat n'est pas ouvert.
yeah. I can understand some of it, but not all of it. Something about
No,
medication?
I'm trying to make sure I get people to engage.
Right.
So that's what I'm suiting to my language so I can get them to engage.
But iPhone 14 put something in chat. What is?
Yeah, so I'm trying to get to the chat, and then for some reason, I am not getting into. So Barbara, if you can get into chat, please let me know.
I can.
Yeah, you got to click on more. Click on more and the chat is there.
Did you want me to read it?
Yeah, you can read it because I'm still trying to get mine.
Okay. Person is saying, you know, well, good evening. Thank you for this great presentation. Their question is there medication that can cause dementia? You got it. Oh my goodness. Yes, that's the question.
There's no particular medication that I'm aware of. It's provoked by diet and lifestyle. The things that people of color are used to eating is not healthy for us.
For sure.
For example, I have high blood pressure. And when I first got diagnosed, the doctor told me the things that I couldn't eat, or I shouldn't eat. No processed meats. That means no bacon. Doesn't matter if it's pork, turkey, beef, no bacon. No what we call lunch meats, no cold cuts. None of those, that's processed meats. No cheese. Cheese is high in salt, you know. Read the ingredients, no, and everything, no condiments. It's ketchup, mayonnaise, mustard. You know.
It's a whole list.
Yeah, no canned food, either fresh or frozen. Even canned food that's marked low sodium, it still has too much in there for you.
For sure.
So it's what, so it's not a medication, it's our lifestyle.
It's lifestyle. Lifestyle's the biggest part. Same thing with me. And because I have high blood pressure, that also makes us increase risk for dementia, having that. So I've cut out pork, beef, canned foods, processed foods. I try to make everything from scratch.
Si nous comprenons ça, on a essayé for sake of time. C'est que yo gen ça nous relève blood pressure, tension. So yo même tous les deux te fait reconnaître que yo gen so pratiquement yo juste changer genre de vie yo ça yo manger. Donc qui fait la maladie Alzheimer, c'est pratiquement changer style de vie non. Si nous comprenons que nous gagnons ou bien si yo dit nous que nous gagnons. Gomun qui fait que moi poser une question. The question is, what kind of test someone can do to detect dementia or Alzheimer?
Okay, I'll answer that, but first, one thing I want to add. In addition to high blood pressure, diabetes is a precursor for Alzheimer's. You're the typical diseases that people of color have.
Heart disease, diabetes, and high blood pressure.
Yeah. Is there a test? There is a medical imaging test that they can do now, a PET scan. And that's how they can determine if a person has it. They can see the changes in the brain.
Oh, I'm sorry. I was answering a text. That was the other we tap dit que gen lot maladie qui ka cause que nous gen Alzheimer's là. So après the blood pressure, c'est problème cœur, problème vasculaire, problème diabète, so tout différent et maladie ça que nous souffrons comme monde qui est descendance africaine. Donc yo capable cause que nous venons faire Alzheimer's.
Yes, I was gonna talk my. There's a question on the chat. Is there a Haitian organization that caters to dementia patients that anyone knows?
I don't know of any.
I don't either.
I was gonna try to Google that.
Maybe you guys can do it.
I know, but there you go.
So if there is one, my guess is strictly my personal guess, nothing to do with the association, but I would look in Florida, Miami area, where there might be or in New York, where there's a larger Haitian population.
Yeah, I don't know of any in New York. I visit New York pretty frequently. I mean, I haven't looked for it, but yeah.
And I have another question. Thank you for that. So we have to make our own research.
Well, apparently there is something. Well, I just saw something in New York City. There's a chapter, but it's saying this chapter no longer exists. But that was from January 2023. So they were offering to help our community. So that's just from Google. So I guess I would inviter moun nan qui pose question, capable essayer Google information, peut-être capable joindre information que l'on cherche.
Thank you. And I have another question. And the question is as follows. Is it difficult to diagnose Alzheimer, dementia in other culture since there are no assessment tools in their language?
No. I don't think so because they have the CAT scans and the PET scans that can scan the brain and see the changes in the brain.
Yeah.
So réponse là c'est que Barbara, go ahead.
Oui, réponse là c'est il y a fait 4 scans, il y a fait test dans tête pour moun nan et capable montrer qui ça qui dans tête moun nan et donc c'est ça capable utiliser test ça yo pour déterminer Alzheimer mais pas gagner et l'autre test et peut-être verbal pour capable utiliser culture moun nan pour poser la question et
I just have a comment. They have other tests less invasive than having a CAT scan. You can do some tests. There's one that they just ask questions and see where the person is at. So with asking questions, you can see where the person, the brain is at. You can, there are other tests less invasive than CAT scan that you can do in different languages because we use them. Okay, we use them. So.
Are you talking about cognitive tests?
The mini cogs.
Yeah. Right. And even though sometimes I think because I work in a hospital where, we did certain MOCAs and certain tests. And I know I mentioned that to some of our team, but I said, there are certain things that you would show certain pictures to a Haitian person, they would know.
No, and that's
not because, they're stupid, they are Alzheimer's, because that's not something that they can relate to. Yeah. Right. So it's hard to diagnose.
And the other part is that you could get a false positive because there's patients that we do those tests routinely. They end up memorizing it and knowing it.
Yeah.
Yes. I was going to say the same thing because, it's a problem because my aunt, she went through that and they could not actually, help out just because of that.
Yeah.
And additionally, with my mother, now my mother was diagnosed around 1995, 96. So this was before PET scan. So these memory tests that you're talking about was the only thing that they did. But the doctors told me point blank, says just because she's passing these tests doesn't mean she doesn't have the disease. Does anyone with education or good street sense will always pass the test?
Yep.
Donc, M. William t'a dit que maman, il t'a examiné tout ça, mais maman t'a passé test, donc le docteur a te dit, même si maman a passé test, mais ça va vous dire que il n'y a pas de maladie. C'est n'importe monde qui gagne, au bon outil connaissance, et dans la vie, quand on a connaissance, il est capable de passer test là. Et c'est pour des fois, on mémorise tout, on mémorise et puis on passe test.
Thank you, Sir Barbara. Continue putting your zip code in the chat so I can copy them. And there's another question.
Somebody has their hand up.
Somebody has their hand up.
Okay, hand up. iPhone 14, you can go ahead and talk. Unmute yourself, please. Thank you.
Bonsoir, merci en pile pour présentation. J'ai une question, s'il vous plaît. Nous connaissons des médicaments qui provoquent dementia. Et surtout, leur prend pile médicaments ensemble, ça compte potentialiser effet médicaments pour accélérer dementia kay moun yo. Est-ce que vous avez un conseil pour moun ka prend plusieurs médicaments ensemble, yo comment vous ka décaler médicaments pour yo prend yo, ou bien si vous ka éviter au maximum prend yo pour ka éviter que vous tombe dans dementia qui causé par médicaments. Merci.
So Barbara, go ahead. Translate.
Oh, I'm sorry. I was reading. Somebody texted me.
You can ask the question. I know you can.
They texted me on the side. I think that's the same question that the person is asking. That's in the chat earlier. I think that's the same question. The same person is asking, all this medication that the person is taking can cause, dementia. So how do we prevent patients from getting dementia since they're taking all this medication? Maybe we can stop them from taking all these medications. And I think that's the same question that's being asked in a different way.
Yeah, so medications don't cause dementia, but medications can cause forgetfulness.
Forgetfulness, yes.
And it can look like dementia.
So hold on 1 second. So médicament capable causer, mon capable médicament pas ca causer ou gen Alzheimer's, mais li ka causer ou gen ou confusion ou ka oublier, mais ça pas cause que ou gen Alzheimer's. Go ahead.
So before taking away medications, it's important to talk to your doctor first.
Avant que retire médicament, il est important pour parler à docteur li d'abord.
Yeah, to see if it's an important medication that you have to be on and have that discussion with them.
Yes, si son médicament qui est important, donc faut qu'on parle avec docteur pour capable examiner ça.
Maybe there's an alternative.
Et capable une autre alternative, un autre médicament qui est capable bailler.
There are also other medical conditions that will mimic
Alzheimer's.
The most common one is a UTI, urinary tract infection.
C'est une infection urinaire, oui.
A person has that, they will present as though they have dementia.
Yes, moun ta ka
Alzheimer's.
prezante kou moun ki gen Alzheimer's.
So they go to their doctor
So
to
you
get the
suppose à faire
test,
docteur, you fait test urine,
take the appropriate medication. The
prend médicament
UTI clears up, their brain clears up.
infection urine nan ale, et puis tout bagay clair. And I may say too, like constipation is another one that causes confusion.
Excuse me. There are some medication like dopamine cholinergic, like there are some drugs or inhibit dopaminergic action on the brain. Those medication can provoke dementia too. I think there's a lot of drugs that can provoke dementia.
Well,
there might be, you know. No research has shown that yet, but that doesn't mean it's not there.
Yeah.
And I'll continue avec question yo. We continue with the question. There is one in the chat saying, someone in early 50s, kind of in a strict diet, because she is a cancer survivor, start having big problem with memory. Should that person be worried about Alzheimer or dementia?
Donc, question, c'est un monde qui gagne 50 ans de comme ça, et dans la première partie 50 ans, qui est anti-jeune en diète qui est très strict, parce qu'il a été fait cancer, donc il fait suivi de cancer, donc il commence à avoir un problème avec mémoire. Est-ce que mon tata doit inquiéter lui de Alzheimer's ou bien dementia?
That person needs to first talk to their cancer doctor.
Mon tata doit parler avec le docteur qui gère cancer lui.
And then talk to their primary physician.
Et puis parler avec le docteur privé.
At their age, they're in the age range for younger onset Alzheimer's.
Là, ça gagne un parti qui est capable de gagner early Alzheimer's.
Thank you so much. N'attends plus de questions et continuez à mettre zip code nous dans le chat là. Mais seulement recevoir 1, 2, 3. I only have 4 zip codes. Please continue and then.
Yeah.
Any other questions? I am 65 plus. And I have high blood pressure. I sometimes forget about where I put things like keys, etc. Et pour l'autre moun yo, moi j'ai 65 ans, moi j'ai blood pressure, moi j'ai tension. Et en pile fois, des fois que moi oublié côté que mette clé, etc. Et puis l'autre bagay encore.
Are you able to go back and retrace your steps and find your keys?
Est-ce qu'on peut retrouver ou retourner en arrière pour jouer une clé? La question ça pour faire que l'eau.
No.
He said no.
Yeah. Then I would again go talk to your primary physician and let them know. You know, normal aging, you're going to forget. And I'll give you an example. Coming in from shopping, got your keys in your hand, you have to go to the bathroom. You just throw the keys down and run to the bathroom. Well, when you put them down, you didn't put them in a normal spot where you normally keep them. So later you go and you can't find them, but you're able to retrace your steps and you'll find them because you know what happened when you came through the door. That's normal. But if you're not able to retrace your steps and find them, then it's time to go talk to your doctor about it.
Go ahead, Sir Baba.
Oui, alors pour te répondre avec la question ça, donc demander que c'est normalement tu dois mettre clé ou sur dans la toilette, mettre clé ou pendant pas entrer dans la toilette, on mettre quelque part, mais on doit alors finir, on pas songer mais at least on peut retrouver, on peut repenser, dans côté avant, on dit seulement me quitter dans tel côté. Mais si on pas retrouver lui encourager pour aller au docteur pour capable discuter ça ensemble avec lui.
Je m'encourage à nous poser plus de questions que nous sommes capables parce que nous avons maladie ça, si nous avons des gens qui bon côté nous capables d'aider nous détecter bonheur parce que plus souvent on a dénié ça. Donc, c'est nous qui avons changement comportement, mon attitude, les gens te connaissent, les pays encore. Donc, c'est un moment pour nous poser des questions. Je suis capable de dire, non, PowerPoint que je te montrer, si tu pas nous intéressé, on a toujours nos copies. Donc, venez avec questions. Nous avons prêté jusqu'à 9h30, les 9h17, nous n'avons pas grand pile temps devant nous. Donc, venez avec questions, nous, parce que son maladie, l'on vivre avec une famille qui gagne, les triste.
Surtout dans late stage.
So, j'espère qu'il y a des jeunes qui sont page là. Côté que nous vivons avec parents, maman, papa, grande, tante, même mon grand soeur, faut nous suivre le comportement changement qui est dans la caille. Et parce que c'est triste pour le monde dans la caille ensemble avec vous, qui te compte tout ça gagne dans la caille, et puis soudainement, même toilette là, on va lié. C'est pour que me mène pour mener. Quand on est qui je vais dans le frigidaire pour manger. Il n'y a pas qu'à avoir une conversation ensemble avec eux. Donc, pas gagner vraiment traitement pour maladie, hein, mais cependant, on est capable de commencer à détecter un série de changements qu'à maman, papa, ou soeur, et nos amis qui vont vivre ensemble avec lui, capables d'agir ensemble avec eux. Donc, on est capable de détecter pour est-ce qu'on est capable de coach famille pour commencer à y. So, poser des questions, nous. Et si dans 3 minutes, pas une question qui est posée, nous allons le fermer, même d'encourager nous, allez là. I was just telling them to ask questions. I'm just giving some example of other families that I know.
Okay.
Seeing this kind of like, issue where they have family having that disease and they don't even know where things in the house are anymore.
Right.
Bonsoir tout le monde. Hello, good evening, everyone.
Oh God.
Yeah, soit parle en anglais, m'a traduit, soit parle créole, m'a traduit.
Si tu ne parler anglais tout, mais aller directement.
Allez directement.
Yeah, this in the chat, I really can't read this one.
Il y a une question dans le chat là.
Go ahead, Baba.
If someone, okay.
Go ahead, yeah.
Go ahead.
If someone living with somebody with dementia, can you actually correct that person when that person is making like something, making you think that she's doing something wrong, like if something, and then you have to just leave him or her? Like if the person is doing something, should you correct the person?
If it's unsafe, then I will intervene. But if it's something that is not harming them or others, then I'm gonna leave them be. I'm gonna leave them alone.
Si c'est un bagay qui ka cause qui mette mon en danger, oui, m'a corriger, mais si c'est un bagay qui pas vraiment important, ou capable de quitter l'environnement.
C'est de belles questions. On a peut-être continué. On a nous. Nous avons 10 minutes encore pour nous faire. Et merci à mon qui a mis des zip codes. Je m'apprécie ça un peu.
Yeah, one observation that I guess I may make that I see at the bedside in the hospital is as I'm remembering this person's question. Let me hold my thought. Somebody has a question. The person is asking, what is the effect on an antipsychotic may have on somebody's brain if they don't have hold on a second.
Can they give them dementia?
Can they give them dementia?
I would have to say go Google that particular medication and see what the side effects are.
Yeah.
And again, talk to your doctor. Ask your doctor. If you have a primary physician that you can't talk to, then you need to find another one. I have.
I can try.
I have my primary physician's home phone number, and he has mine. I've had this physician for it's close to 20 years, and I got him when the other one I had before that retired. I find a doctor and I stick with it. I do not allow my insurance company to pick my doctors.
Nope.
I picked a doctor. Now, when I was working and my employer changed insurance companies, and my primary was not part of that company, so I had to pay out of pocket. So instead of going 4 times a year, I only went 3 times a year. But I still went to my same.
There's always a way.
but I still went to that same doctor. I was not going to change.
I had a different doctor, and I had their cell phone number. And if I had anything, I would text him and he would tell me, come right in. I do have a new doctor, but I've known this doctor for many years. And I've had him for about 2 years now. And same thing, I have his cell phone number and his wife's cell phone number because they both work together.
Wow.
And email. So
And email.
Yeah.
Wow. Wow.
Yeah.
Mais il a expliqué que comme quitter assurance de dicter nous qui qualité docteur nous doit gagner, c'est nous pour choisir docteur nous et nous capable stick avec un docteur qui a gagné monsieur William dit que docteur parle là plus de 20 ans. Même le que tu gagné paiement que pour t'a fait chaque temps la docteur il juste réduit visite mais tu toujours le même docteur li et monsieur Anna just dit le même tout il y a un nouveau docteur même téléphone cellulaire docteur a gagné madame ni etc. donc il va suivre docteur tout et il était très close avec docteur.
Ms. Barbara, can I say something?
Oh yes, you may.
Good afternoon, I'm Billy. I can say yes, the medication can provoke dementia, but if you follow your doctor, you be steady with your follow-up, your doctor will be able to detect any new concern. Because if you have follow-up, you go to your follow-up, they're gonna ask you questions. And if your question like, some side effect, your doctor should be able to take action. But if you don't follow up, evidently you're gonna be the worst. You're gonna find out when it's really worse and worse. So I think the best thing is to follow up, be the steady follow-up with your appointment with your provider.
Thank you so much.
There's somebody raising their hand.
Yes, we have the iPhone raising the hand. So you can unmute and talk.
I think it was me.
Julie.
Okay.
So now I can ask my questions. The questions was, what advice can you give a caregiver that live with someone that got dementia, but always frustrated, specifically on sundown, like in the evening, the person always said no. What best advice you can give to the caregiver so they can get less frustration?
I have so much to say. This is what I specialize in.
I want to go first because I want to give bad news. Now let Joanna go and give good news after it. To the person that's asking, caregiver. There's this little school out in California called Stanford University, and they did a study. And their study says that 40%, 4 out of 10 caregivers die before the person they're taking care of. I'm looking at the expressions on faces here. I read a recent study within the past month. That number has gone up to 60% for Alzheimer's. So, advice for you, take care of yourself first. You are number one. Don't neglect your medical doctor's appointments to take care of that person. You get plenty of rest. I know you're not, because you're people with Alzheimer's tend to wonder at night. So you're not sleeping good at night because you're worrying about this person that you're caring for. You've got to take care of yourself. Now, go ahead, Joanna. You give her the good news.
So this is something that I touch on with my clients all the time that I'm coaching. So my question to you is, what do you think about the word selfish?
It's a question for you.
I'm sorry, what you said?
What do you think about the word selfish?
My question was not really on that way.
No, oh no, I understand, but for the
What are you
meaning,
going through?
for the meaning, what do you feel about that word?
It exists. Sometimes it happens.
I say, number one, get a support system in place with your families, your neighbors, your friends to give you, even if it's an hour a day. And two, learn to be selfish, and it is okay. You have to put yourself first and take care of yourself first before you take care of somebody else. It's very hard to do, but you have to do it.
Sir Barbara or Sir Colleen, can you after Dooley, est-ce que nous capable de faire une petite traduction? Just to summarize.
Insurance.
Okay, you can finish.
Yeah, Dooley, go ahead, Dooley.
Too much background noise, so.
For me?
No, do you have anything to add, Dooley?
No, I was saying like the frustration is because like when you talk to the dementia person, on the sundown they always said no, or they're being like rebellion. But not because they're really rebellion, it's like the condition of their disease. So what advice can you give to the caregiver or to talk to them to redirect them from their behavior? Like, by example, if you ask them to do something and they say no, instead of ask them not to do it, there's another way you can approach them to prevent that frustration. That's what I was saying.
If what they're doing is not hazardous to their well-being, their safety, leave them alone. You will never win an argument with that person.
Si capable ajouter, pas ajouter. So, si gon moun ki gon famille qui gen dementia, ça que Mr. William connaît, pas aggraver moun nan, l'el parler ou bien la font travail qui pas mettre du feu dans kay lan, qui pas causer un danger.
Un danger.
Donc, depuis pas causer danger, li pas cause un problème, quitte moun nan repos. Parce que si ou apé tapoter avec lui, ou apé excité ou, then li ka cause plus problème. And we have another question, two questions as a matter of fact. Most insurance provide respite care for the client.
It's a comment.
Say it again.
It's not a question, it's a comment because I deal with them. So the insurance company, they provide respite care for the client. So you buy, si ou gon assurance, ou gon moun la kayo ki diagnose que di moun na gen Alzheimer, okay? Si moun na gen dementia. So plus assurance là, parce que go back le caregiver burnout, parce que ou même ka provide, ka aider moun tout le temps, gon konto rivo pas capable encore. So you buy moun on chance pour moun venir dans nursing home, you le respite care. So en pile moun qualifié pour ça. So pour buy moun non petit temps ou même pour ça, mon petit bruit, pour ça à l'anti vacances à l'anti côté. Il y a pile côté qu'après moun nan peut buy moun respite care.
Thank you so much. And I think she was talking about respite care. And I think the Alzheimer Association have a program like that. Correct me if I'm wrong, please.
That I'm not sure of. They usually direct you to somewhere.
Yeah.
Did you get a call yesterday from Mary Beth?
I did, and she's going to investigate some other resources. She did mention about that respite care, but she will tell me more about it.
Okay, yeah, she's coming up to your place this week.
Usually it's in a nursing home. They put the person there's respite care in the nursing home. You a dans les maisons et vieillesse yo, et puis pour n'y a gen moun ki qualifié pour une semaine, gen moun ki qualifié pour 2 semaines par an. Ça dépend de qui assurance ou.
There's also respite care in the home. They're the person living there.
Yeah.
Someone can come to their house, and then you as the caregiver can leave, or to be there, but somebody else is taking care of them, however you want.
Yes. And then the other thing I'm just gonna add, because I deal with them every day, I'm certified. So the other thing I book the moun haïtien yo, le nou gon moun ki genye Alzheimer la kay, nou pa fait argument avec lui. Côté moun nan ye ya, ou rencontre côté ça. Li do maman là, ou dit oui, maman là. Ou pas besoin de dire, oh, maman mouri. Li pas bon ni pour vous-même, ni pour lui-même. Ou monte tension pour grand messi, ou monte tension moun nan pour grand messi. So, li toujours better, côté moun nan ye, as long que moun nan pas en danger, et puis li pas font ba ki mal, côté li a rencontré le même côté. Ou quitte le dit salve pito, ou quitte li. Et puis, ou pas, te pas déranger aucun monde. Ça, c'est bon, d'aide, d'ajouter.
Thank you so much. We're just talking about, meeting the person where they are when they saying, like the same thing we were saying. If they say something, they do something, it's not killing anybody, it's not destroying the house, just leave them alone. So, nous avons question commence à venir, mais dans le moment que nous allons le fermer.
Oui, il est 9h33.
Il est 9h33. So, I think we're going to end the night, the session. It's been such a pleasure to have you both explaining the Alzheimer, the dementia, because that's really interchanging, because people think, dementia is one, Alzheimer is another one.
Oh.
So that was like a good, eye-opener for that. And I think everybody really understand the signs of dementia. And as I mentioned before, if you need the PowerPoint, we can make you have it. And I want to take the advantage also to thank some of the people from the Alzheimer Association that helped that happen tonight, besides Mr. Michael Williams and Ms. Joanna Hernandez. We have Christina Pendergast. Please tell her thank you for us. We have Caitlin Clark. Tell her we appreciate, her effort, and to thank her. And also Mary Beth Lewis, that, make us connect to you both. And the email was like, almost every day she was on point. And as you both were on point. Thank you so much. We're not going to forget the console person, Selena Kelsey. She's always there for us. She's the Zoom user that's helping us, put this together. And she always does a good job, and there is no word to say thank you. Always make herself available for whenever we need the Zoom. And to you all, tout le monde qui a participé, nous disons merci. C'est pas une maladie qui est commune, mais li commun. En ce sens, c'est parce qu'on pas reconnaître li, ou pas qu'on signe qu'il faut pas connaître que mon gagne. En pile fois nous dit signe au moment. Oh, m'blié. Mais c'est pour même garder mon entre amis, nous dans l'église ensemble, nous gagne moun que nous travaillons dans le groupe ensemble avec eux. Ouais, comment attitude a changé. Ouais, qui genre tempérament yo. Ouais, qui genre que tout a dit oublier, ou monter pas avec eux, oublier rendez-vous, oublier réunion, oublier date, oublier tout bagaille. Tout ça capable aider nous, aider population. Donc c'est ça que me devait nous comme conseil. Quoi nous prend assez, et une bagay si nous gagne pour nous kembe, c'est veiller changement qui gagne kay moun nan, et si notre bagay nous gagne pour nous changer, si nous ouais moun nan ti gens agité que c'est mari, madame, n'importe, différent de gens qu'on y a ensemble avant, pas pousser. Li di maman mouri, ou est son bagay qui sorti qui pas normal la kay li, faut poser, pas pour y bataille ensemble avec elle. Donc sou ka essayer poser la question pour comprendre ça qui a passé. Nous capable faire ça, mais pas bataille ensemble avec moun yo le gen problème ça. So nous connaissons comité santé là qui ka aider nous. Si nous avons des questions, nous connaissons qui est-ce qui fait partie. Donc parler ensemble avec nous, nous capable toujours là pour nous aider. Et si nous sujet on tendre suggérer nous. And again, I want to say thank you to each and every one of you.
Thank you.
That was very nice.
Thank you.
Ms. Joanna.
Very, very nice.
Thank you.
Thank you so
Mr.
much.
Michael.
Thank you very much for inviting us.
Really appreciate it.
Appreciate it.
And for a Saturday night, we couldn't ask for more than that.
It's raining out, so this is a better way of spending my Saturday night.
And even on the page, people are saying thank you to you guys.
Yeah, you're quite welcome,
you guys
everyone.
for having us.
Thanks.
Thank you. Thank you for coming.
Well, call us back.
Yes.
One of the other programs that we do is called Healthy Living for the Brain and Body.
Okay.
So that's a follow, because some of the questions that were asked tonight would be answered in that program.
Yes.
Oh, so which means we can invite you to come back with those.
That's it. That would be a better note.
Selena, if you could put everybody on the page. Jeff, can I have your zip code, please? Edwidge, can I have your zip code?
Oh, I thought I did. Oh, sorry.
You did. No, I don't have names. That's what I don't know.
Okay. All right, I'll do it right now.
Okay. So I'm just trying to pick on some names that I can see in front of me, because I have to present that to them. That was the agreement that I have. So I have to respect that. The respecters have to respect mine.
19026. 19026.
Okay. Was it explained to you why we need that?
Yeah,
he's explaining why he needs that.
Right. We get, obviously, we don't charge for this. We out here for free. The way we get compensated is from the government by grants. And the way we get the grants is by showing we've talked to these many people in these area codes. And that's all part of when we do grant writing. I see Rose shaking her head like she's probably written a grant or two. And so this is why we need these zip codes, people's names and their zip codes, to prove, so we can get money from the government, and we can still keep coming out and doing this for free.
Yep.
So, Mr. Williams, a part of the zip code, would you like me to provide you with name, or the zip code is enough?
Name and zip code if possible. If you can.
I only have zip code. Is that okay?
If that's all you got,
we can add them real quick.
Does it have to be like from this particular meet?
No, it doesn't have to live in your area, wherever they live. Whatever their zip code is,
All right.
You have a good amount of
zip do it quickly.
Oh, I see a lot of stuff coming into your chat with names and zip codes now.
I'm just taking picture. Let me take my phone so I can help me. Thank you for following.
You can save the chat. You can just
you can save the chat.
I am not sure if she saved it. That was the question that we had.
You can save the chat.
Selena, she mentioned that before, like.
I know she did say, she wasn't.
She did set it to save the chat, so at first.
Well, do a screenshot.
Yeah, it's not a screenshot.
There you go.
And we know some of the people, so we can go back and get some names.
Okay. I could not save the chat because I did not set up the Zoom to save chats, because it's something you have to do it while you're setting it up.
Oh, okay. Yeah, because I'm clicking on the part where that would be, and I don't see
I
it there.
provide you with what I have.
Yeah, when Mary Beth comes out there, she's coming out Wednesday, I believe, and just give it to her, and that's it. That's all you got.
Yeah.
Yeah.
Thank you so much. And one more time, you have a good night. And then we appreciate, your effort to come here. And then you promise us for another one. I think it's Healthy Living.
Yeah.
Savita.
Yes.
Savita, remember to tell him one zip code can have many people. Remember, most of them live in only one area. So not because you don't have a lot of zip code, you don't have a lot of people.
That's why it's better to put your name in the zip code.
Right.
Yeah, because I know actually there is one house that I was talking to them. They have about like almost 10 people in the house.
Yeah.
And they're within the zip code 191111.
And also remember
that's my zip code.
the way I live, most of us live only in one area, like the 19122, and you can have the whole, like the church, everybody live around there. So one zip code doesn't mean there's only one person. You got a lot of people there.
Yes, that's why you would need the names. If you got 15 people under that one zip code, then you need all 15 names.
Yeah.
Okay. We'll do the best we can, and most of them we know, and we will try to get the names for you and the zip code. And then could you please just mention all the different virtual education that you have?
They have a lot.
Well, whatever we do, we can do virtual or in person.
Yeah.
So whatever, if you went onto our website and you see the list there, we can do them either virtual or in person. It doesn't matter. This one that we did tonight, I'm doing virtual. Next Saturday, I'm doing this same thing in person at a church in Southwest Philly.
And they have some upcoming education that they're doing. If you are interested, let me know. I'm part of the team that I'll make sure they get it. But other people would like to either attend in person or virtually. If you're really interested, let us know. We'll make sure you get it on your calendar. And once again, if we keep on going, we will never stop because it's a very
I have a question. We have some people from Haiti who's listening us in Haiti. Do you need the zip code too, or is that okay? We have some people in Haiti.
There's no zip code in
Listening, participating.
Well, for those people, if that's where they physically are, I would say use their name and the church's zip code.
Okay. Oh, that's a good thought.
Dr. Berman, you will provide me with those names, and so we can put them under the church. Okay.
No problem. I'll do that.
Okay. Whomever is listening, watching, so you can call one of us. You know me, Vida. Sir Colin, Sir Wabra, wherever, you can meet one of us, Dooley, Nadia,
Edwidge, Barbara.
Edwidge. So just, hey, I was in the Zoom. I got so-and-so family, zip code. So do that by, today is Saturday. If you can do it by Tuesday evening, I will appreciate it. So I can provide that, to them by Wednesday. Sound like a deal? And once again, I can't thank you enough. I kept saying thank you and thank you because the word that we have for now, I hope they have like a different word that would be like more powerful than thank you. So I could use, but that's the only one that I know for now. So you all have a great night. And thank you, Barbara. Thank you, Colin, for
thank you so much.
And having people understand, of what's going on.
Thank you too.
Thank you to our interpreters.
Thank you, Savida. Thank you, everyone.
Thank you, Savida. Great job. Thank you.
Thank you.
Bye.
Good night.
Good
Until
night.
next time.
Good
night, everyone.
Don't forget to say thank you to Christina for me, to Caitlin, to Mary Beth.
Right.
So they were all working on that for me as well.
Oh, well.
And
right.
good night.
Good night.
Thank you, Selena. Thank you all.
Thank you.
Bye-bye.
Bye-bye.